Hi everybody, in today's video we're going to be talking about surgical scars and whether they be old or new, how best to treat them. So when I'm treating a surgical scar, I usually like to divide and conquer, and I do that by forming three categories. And the first of which is like an older, more mature scar. Those are going to be white or hypopigmented. They're flat to the surface. They can be atrophic or hypertrophic scars, meaning they're either elevated or depressed. And the second category is a more like stable red scar. It's flat to the surface. It's always red. It's usually about 2 millimeters, somewhere around there in thickness. And it's usually always not on a tension area, meaning like an elbow or some joint somewhere where there's movement. And the third category is going to be the more severe, unstable surgical scars. So think of this kind of like the hypertrophic where they're raised, kind of like a keloid formation. They're usually thicker than 2 millimeters and they can be a bit longer. Typically they're over joints, so they're over those tension areas. And also these scars could be forming because of a reaction to sutures. Now, when it comes to treatment, there's a lot of scar therapies out there, and most common are going to be like your devices, so vascular lasers, pigment lasers, fractionated, and RF devices. And then of course you have your drug therapies like PLLA, which is Sculptra, bimatoprost, which is Latisse, corticosteroids, 5-FU, and then botulinum toxin. So before we dive into the treatment for each individual scar type, I want to talk about early prevention. And what we're finding now is that following a surgery, within the sweet spot has been 3 to 6 months, we would go ahead and treat that scar with a PDL laser or a non-ablative laser. And this really helps decrease the risk of hypertrophy in a high tension area. So that could be a breast scar, that could be a kneecap scar or elbow, some high tension area. And the first category is going to be that older, more mature scar, usually flat and white. And I actually did a video on this recently, which I'll link above for you guys. But in short, what we've done is a combination of ablative fractionated laser, and then following that, a topical application of bimatoprost, which is Latisse, and it's actually been shown in clinical studies to repigment those cells permanently. And then when we move into the second category, that's going to be your red stable scar. And typically that's a combination of three therapies, the first of which is like a vascular laser, then a non-ablative fractionated laser, and then follow that up with some type of intralesional corticosteroid or 5-FU. And usually that takes anywhere from 2 to 4 treatments, typically spaced out 4 to 6 weeks. And the third category, which is the most severe, unstable, hypertrophic scars, that's going to be kind of the same combination. So you want to do that vascular laser for any redness, and then a non-ablative fractionated laser followed by the intralesional corticosteroid or 5-FU. Sometimes this can take a bit more treatment, so it could be anywhere from 2 to 5, but it depends on the person. And this has been proven to work very well for those larger scars. All right guys, that's all I have for you today. Thank you so much for joining me. And if you guys have any questions about surgical scars or scars in general, feel free to leave it below. And if I don't know the answer, I'll definitely find out for you. All right. Until next time, take care. Bye.